Welcome. This is Jeff Johnston, host of the Living Undeterred podcast, and I'm excited again. I don't know where this conversation's going. I'm trying to put Peter in a box, and I can't do that. So I asked Peter earlier, "How do you want me to introduce himself?" And he said, "As a disruptor." So there you go. At the end of the show, we'll have an idea where he fits in. But I'm really excited to talk to him because we met on, like I do a lot of my guests, on LinkedIn. And I was either him and I were pulled into a conversation or we were introduced through somebody's statements or comments, but really intrigued in his initiatives that he's working on and kind of his mindset with specifically addiction and substance use distress and then mental health overall. But I have a lot to talk about today, Peter. So sit back, put your seatbelt on, and welcome to the show.
Thanks for having me, Jeff. Looking forward to it. And,
Yeah. So what's a disruptor, man?
one of many, I guess. I was trying to cherry pick. I'm not very good with the labels, but I guess I also identify as a recovering clinician, not only as a person in however one wants to call it or identify with it. I don't like to really be a word policeman, but a person in recovery who then went into the clinical world. And I got kind of disillusioned with clinical practice in some ways. So then would almost refer to myself as a recovering clinician as I then kind of evolved into more program design and executive or administrative roles within the space and disruptor in the sense of what burnt me out, what I thought wasn't working was, I mean, we hear a lot about in this space, a lot of trending and topics around the broken system, but why is it broken? How is it broken? How is it so different in many regards than every other facet of healthcare or behavioral or mental health? So really, the system needed disrupting. The system needed, in a very positive way. At the same time, kind of one of the inmates running the asylum in some regards. I had to enter treatment myself. And I was in need of help. That was back in the day when there was just one size fits all, one, prevailing ideology behind it. And really one way was the only way.
Is that the AA you're talking about then?
And in some regards, the 12 steps are where my DNA of this journey lies and the DNA of a lot of who, or where my transformation came from. But that being said, it also in many regards shaped what then, evolved as clinical practice, kind of tail wagging the dog, policy, even down to other areas within that system, insurance reimbursement, criminal justice system. So it became very difficult from a practitioner standpoint, from a research scientific standpoint, these things aren't really jiving, that there's ideology and fellowship and a lot of beliefs. And then there's science and research and kind of cutting edge practices and essentially a whole other world that was happening parallel. And this world of recovery, of treatment, of recovery communities, AA, 12-step fellowships was very, I'd say, isolated in many regards and very closed off. And a big thing that I was gravitated towards that was also happening. I'm kind of going on tangents. You were right about put the seatbelt on because towards the end of the day,
with a little we're just getting started, man. I'm worse than that.
But another thing that was happening was, a real kind of polarization also of, am I an abstinent based or 12-stepper versus a this versus a that? And that was a big problem also that, in addition to the system being broken, and we can get into all that unpacking of what's wrong there. There was a cultural kind of phenomenon and movement or lack thereof that I also kind of felt, and I'm not the only one, I'm not coming up with this by myself, needs disruption, and this us versus them, or why can't we all coexist type of thing, and find common ground and really realize I'm doing a clinical training on integrated harm reduction psychotherapy. And a lot of times harm reduction is looked at as antithetical to abstinence-based treatment. It's not at all. It's right. They absolutely can coexist, are very synergistic. There is absolutely nothing about harm reduction that even contradicts abstinence basis. in theory and modality. It's just there's a wider envelope. So back to the original point of disruption, we just need to do that, widen the envelope, break that box.
It's pretty clear that if what we were doing was working, we could just
can you speak a little louder?
Right? It's pretty clear if what we were doing was working, we would just do more of it. And it's painfully clear looking at the statistics that what we are doing is not working, and so we need more options. We need more arrows in the quiver. And I've kind of run into this, and I'm only 5 years into this mental health advocacy space, Peter, and I get frustrated because everybody thinks they have the solution, and one person will say it's AA, that's the best way. Someone else will say, harm reduction, that's the only way. Someone else will say, nope, it's a choice model. People can just choose to quit. It's a moral failing. I mean, you just gotta just like quit, like I did. I just quit one day. I don't go to meetings. To me, it was just I quit. I didn't want to complicate it, and so I could easily take my experience and say that's the way it should be. And I think that's my frustration, Peter, with this whole recovery, advocacy, mental health, every scenario, even suicide awareness, it's so agenda driven. It's so my story must be the right way because it's my story. And everyone's siloed. Not many people are working together. And I'm trying to break that. That's what my tour was about this summer. Getting in an RV, driving around the country, not about me, but about how can I learn from Peter, take his life experiences and his, clinical experiences, and how can I take a couple things from that and then meet somebody else, take a couple things from them, and then ultimately empower myself to become a better person and those people around me. And that's the good thing about this industry, is that there are a lot of people out there with a lot of really good, valid arguments and positions and strategies. But then there's a lot of ambiguity and a lot of frustration because what works for one person doesn't work for somebody else. That's a challenge.
It absolutely is. And by the way, it goes both ways about learning, and that's another thing about even things like, clinical practice doesn't have to be constrained to just clinical practice. In some regards, I don't want to use those words, should or shouldn't, speaking of clinical practice, you're not supposed to say that, but it shouldn't be, because life doesn't exist in that vacuum. So, there's always this, what could I learn from somebody doing this that might work this way, or that could impact that? So I kind of subscribe to this belief that everything's learning. Everything is about collaboration in many regards. And in like almost a fractal sense, from a practitioner, right, boots on the ground, there will never be a case with any patient, client, however one wants to call it, that a single treatment provider can produce the optimal results. Collaboration is always the key. Integrated, comprehensive treatment, or whatever verb you want to use, is a key to desired outcome. That being said, one of my favorite phrases, especially working in this space and field, is nothing's everything, because of exactly what you said. One of the greatest themes throughout, the rehab industrial complex is some form or another of this is everything, this is what it's all about. And nothing nothing can be by nature of that. And a real challenging aspect, going back to, and I say it kind of half joking, but the whole inmates running the asylum thing, is it almost mimics the only other kind of organization that I could think of that's somewhat similar, and I mean it in an organic way also, is something like the Defense Department and Pentagon, where you have this enormous percentage of the workforce, the staffing, are veterans of some form or another. So you're in a very particular mindset with a very set kind of paradigm under a very strict values and belief system. Very similar case with substance abuse treatment. By and far, the overwhelming majority of the workforce are people in recovery. So that phenomenon that you're describing, as true as it is, and as easy as it is to, and I can point a lot of fingers, and I do, very frustrated at times and angry with a lot of things that have happened within this industry, and the list is very, I mean, as you've experienced very personally, the list
Right.
is too long to even go down and itemize. But one mitigating factor is because you have all these people in recovery and, essentially are stakeholders, you have that adamance and that fundamentalism. And it's a really kind of fine line to walk and balance, because it's the best of intentions, but it's really, it's backfiring, you know.
Yeah. I get frustrated again, like I said, because I see well-intended people, especially on social media, that end up going down rabbit holes that are very unproductive. And that's one of the reasons why I'm not overly active on social media right now, in regards to just interjecting or injecting my thoughts on comments. It's like, be honest with you, I'm too busy out here in the trenches actually doing things. I don't have a lot of time to sit on social media and argue with people whether this safe needle, disposal and or availability or fentanyl test strips are good or bad. I just don't have the time for
I
that.
don't
I
even
just
think that's
kind of got burned
and
out
I'm
of
sorry
that.
to cut you off with that, but I also don't even think that's the audience to even focus on.
Good
And
point.
in many regards, those, and why I'm also somewhat sensitive to that term disruptor, where, like, in some regards, a lot of the instigators of those arguments, people can find problems
Right.
in any solution, of a certain mindset. And like you're saying, I don't want to waste my time with them. I want to focus on who are working towards solutions, who are like-minded in terms of philosophical beliefs of, let's collaborate, let's look synergistically, let's look more comprehensively and integratively. So, yeah, I very much agree.
And it's such, I mean, um, the evolution of this industry with mental health is becoming quicker and more adaptive. And we have things like cognitive behavioral theory, CBT out there. You have TMS, the brainwave technology stimulations. You got the burgeoning psychedelic, resurgence, I guess, because this psychedelics isn't new.
Exactly.
It's been around. Probably that's the oldest method is psychedelics out of everything we're looking at right now. Yet in the 70s and 80s, that just got set aside because of the war on drugs. And it's unfortunate because it looks like we had a lot of good progress in regards to psychedelics being, being a tool, an arrow in the quiver, as I like to say. Not an end all be all, not a cure of everyone's mental health. Probably some people is going to be a really bad experience. I, full disclosure, have never had a psychedelic experience, but I think as an advocate and seeing the numbers all going in the wrong direction, I better be open minded to just about anything right now. And plant based medicine to me seems just very logical. It's been used by indigenous people for thousands of years, and again, if what we were doing was working, I wouldn't be overly concerned right now about just double downing on our current efforts. But have you seen The Fix, Johan Hari's 9-part documentary with Samuel L. Jackson
Yeah.
as voice?
Um,
What'd you think about it? I just saw it
I
last week.
think his premises are really sound, and going back to,
Presents a good case.
where he originally came on the scene, with that TED talk of, everything you thought you knew.
Yeah.
And I very much believe, not to contradict nothing's everything. But I do believe that certain things are, kind of like force multipliers, or really, of such critical importance that they do kind of rise to the top. One of those things being connection, lifestyle, and basically a lot of the things that are out of that clinical envelope. That in some regards don't have diagnostic statistical measurement tools around them, so they kind of get lost in the ethosphere.
Right.
And so I think, points that he's making in that documentary, there's such an exciting new, just, whole library of material. I mean, I can learn more now in some regards watching Netflix than I can in 2 years
I
of
know. It's
clinical
crazy.
schooling. It's really
Yep.
fascinating. And it I think, getting back to something like psychedelics, which is trending so much, it's such a hot topic. It's almost mimicking some of the other models that we saw in substance abuse treatment, a Wild West, a lot of silver bullets, a lot of
Mm-hmm.
charlatans, a lot of
Mm-hmm.
grandiose claims, and you hit the nail on the head,
Yep.
a tool, a quiver in the arrow. That being said, psychedelics are one of a few things that do represent this real just paradigm shift disruptor, just real seminal game changing moment in where we can potentially see, and not even potentially, where we are seeing, and I have seen firsthand in practice, uh, results that were just unheard of, uneven fathomable in some regard.
Right.
And I was the greatest skeptic of them all, coming from that more
Yeah.
traditional 12-step based original philosophy schooling and training, then advancing into clinical training, kind of coming from more of an analytic background than a cognitive behavioral theorist, applying that and relational. And, it was very kind of clear evolution to that. But it, so I'm just getting sidetracked because a little
No, I
maybe
was just gonna jump in and yeah, I know. I saw and forgot the name of your child
Layla.
again. Layla, that's right. But a beautiful name. I was thinking about you talked about paradigm shift and all that, and the my understanding when I listen to people talk about psychedelics from a mental health standpoint now, or a mental wellness perspective, is that there's this we have as humans this, as I like to say, kind of this illusion of self. I mean, there should be an illusion, but we really think there's this self entity, and so we run around life in this this robotic position where we're looking outwards, and we rarely see life looking back at us unless we do it in a narcissistic or an egocentric manner. And my understanding is psychedelics releases us from that prison where you basically lose your ego, not your identity, but your ego. I don't know if that's true or not, but it seems to me that would be a neat alternative or a neat experience for people that are looking to turn the lens a little bit on how they look at mental health today. I don't know. Like I said, I've never had an experience. I know many of my friends are now starting to do things such as ayahuasca retreats. I had Jonathan DePotter on my podcast. He runs Behold Retreats, and they're all over from, I think, Singapore, Thailand, Australia, Costa Rica. And he was talking about, this kind of this new renaissance or this awakening with psychedelics, but there's such a pushback. It's just almost like it's like medically assisted treatment. It's like methadone. There's just pushback on people that are just so, how can you fight fire with fire type thing? Why are you using drugs to fight something that drugs created? And I don't have an answer really for that because I'm not a clinician. But how do you answer that question if someone pushes back on that?
in so
And what
many
is a
ways
good
because
answer?
it's not one question. It's almost like
Right.
analogizing, and I don't need to keep going to like warfare, but go figure.
That's okay. It's
It's
my
like
podcast. You
trench
can talk about anything you
warfare
want.
versus like this more modern, what we now know as asymmetrical, warfare. And so getting into those
Right.
types of questions is really more metaphorical to that trench warfare, where that's just not how things work. And so for medicated assisted treatments, one of the real precipitators of my kind of really becoming disillusioned with clinical practice was because the data and evidence was so clear on what was going on, and the science behind what was going on was so clear. And then at the same time, culturally, practically, what we were seeing just from like a phenomenon standpoint was so crystal clear in that pushback that you were talking about, to the point that there was really more
Mm-hmm.
internal stigmatization than there were external barriers. All of the talking points, like you said, you're replacing one for another. It's not real, true abstinence and recovery, a whole litany of talking points.
Mm-hmm.
But then you got into really what was going on and what were the arguments, and almost similar to like another model or metaphors like COVID and vaccines. Is it just about
Mm.
vax, don't vax, or do we talk about the science? Do we talk about the pathology? And so with medicated assisted treatment, you're not talking about one thing, and you're not even talking about one
Correct.
modality. Even something like buprenorphine, some of the biggest problems with buprenorphine, in my opinion, according to a lot of the data and research, isn't the medication, the drug, the mechanism of action or efficacy itself. It's the models in which it's prescribed and the way in which, the mode in which it's ingested. It becomes the most, it becomes diverted. It's one of the most smuggled substances there are right now. In jails, there's more Suboxone than anything going around. It becomes so, then in practice, so many of the problems that you then hear fast forwarding, I can't get off it. This doctor just, would write scripts, do this, do this. It really was where the rubber met the road and how it was being kind of introduced, prescribed, the method and mode of ingestion and all of that, versus having anything to do with how the actual medication worked. Fast forward to something like a Sublocade. When I was running this facility in New York, it was one of the first medically run substance abuse facilities. It was started by two physicians. They brought me on board and run it, design a lot of it. And back to like TMS, we had TMS machines, we were doing chemical infusion.
Right.
And we started to get into this, what was at the time, by Indivior, a new substance called Sublocade. And I was still a little on the fence with buprenorphine, which, for operative standpoint, we can talk about Suboxone, because that really is the most normalized use of it.
Right.
And then all the typical, cliches with it. Now you have Sublocade, a 1 month injection of the slow release with a very natural titration mechanism. Becomes a wonderful exit drug. So now all of a sudden you don't have any of the compliance issues. You didn't have any of the issues of you can't get off of it. It became one of the easier medications to then titrate off of and to really be a wonderful exit drug out of. But at the same time, provide that real proven efficacy of what that medication does to assist with treatment. And so, it's hard to just take on that argument as one argument, because it's all right. We've got so many medications that there is no argument. Do these work? There can't be. There can be an argument, and a valid one. All right, in practice, how are these medications being utilized? That's being addressed. And now another whole thing is it's not MAT as we knew it, because now it's a more operative term is MOUD, MOUD, medications for opioid use disorder that we use to help with it. And that's where even things like psychedelics, other plant-based medicines. I mean, our physicians with recovery spot at that time were integral in getting opioid use disorder as a pre-existing condition for prescribing medical marijuana. Not for everybody. And this brings up another whole tangent. Not all addicts are the same. Not everybody coming in meeting diagnostics criteria of substance use disorder or this disorder are the same. Requiring the same, with the same prognosis, same treatment planning and all that back to everybody's an individual. But that being said, it opened up this whole wide new horizon of, wow, what's really possible, and where are, like you said, even going back to the 60s, 70s, these just troves of research and data that really show how well these things work. And then now bridging that gap even down into things like psychedelics on that, let's say, further end of the spectrum of what's really out of the box, what's really kind of disrupting and dropping bombs in that world, and we know it. And back to like kind of what's a theme, nothing's everything, things are tools, an arrow and a quiver. What you just described about one aspect of psychedelics is just that. It's one arrow in the quiver. Backing up, psychedelics aren't just one thing. And that's where there is this real big movement to almost just make it all one thing, and it just isn't. You're talking about a list of different potential medication substances. Psychedelic by nature of the term itself just means mind manifesting. It was coined by I forget, it's a psychiatrist, professor from Stanford, somewhere out west, way back when. It doesn't have clinical backing to it. So you have a list of medications or substances from, things like mescaline, peyote on one end, to MDMA, completely engineered.
And psilocybin's the hot one out there.
And so even things like ayahuasca, when you really break it down and what's happened, because it's all about the metabolites. It's and how the body metabolizes it. The body metabolizes that as MDMA, essentially. So that's why you would have, a multitude of different experiences. So back to like what's going on, and is that, removal of ego and that kind of disassociation from self, that is a huge part of it. And back to also, not everybody's the same. And just like with other aspects of medicine or treatment, well, what is going on? And let's match what would be the most appropriate course of treatment to kind of address the underlying root of what is going on to produce that desired outcome. Back to other, kind of aspects of psychedelic. It's not always just the experience and what happens there, but it's even getting into the brain as an organ. And as a physical substance and what's going on physiologically, and you have with other compounds, ketamine in particular, where there's a reason that you have FDA approval. MDMA now is in phase 3 clinical trial, because you're also seeing with tremendous clarity back to research data, all of what's being done to show there's neuroplasticity, synapse repair, real hardware things going on in addition to those software updates. And one thing you described, has not been able to be accomplished in any facet of traditional psychotherapy, whether it's kind of Freudian, analytical, any facet of cognitive behavioral. And a lot of that does have to do with that disassociation, that removal of ego or self. Like, you can almost have an ability to look at things in a way that you would never have been able to look at in regards. And in some regard, the very underlying disorder that one might have is integral in preventing that ability to look. Trauma would be one example, right? Yeah. So trauma response would be in the neural network would be to shut down certain pathways to almost disenable somebody from accessing and recalling certain memories. Or, it's not just that, as a lot of traditional and disease model, very reduced, simplistic forms of addiction or other mental health. It's all about the limbic system, just that prefrontal cortex and the base brain. It's that lizard brain.
And that's what gets hard for me sometimes, Peter, is you get respected experts or advocates, Dr. Gabor Mate, Johan Hari, who look at addiction differently. And one thinks it comes from the result of trauma, childhood trauma specifically, in Dr. Gabor Mate's case. And Johan Hari thinks it's a connection and relationship vulnerability type issues. It's more the inability to connect well with other people and ultimately yourself. And so you get, as this guy out here in Iowa who's lost 2 loved ones to this stuff, who has self-battled with alcohol and gambling, what's the right amount of potion that can, quote, fix me from these issues? And I've come to the realization that the problem with mental health is it's subjective. If I were to ask even clinicians, other than just the textbook definition, which let's just say that's not even available, so you can't Google mental health, and I asked you, write down in a couple sentences or a paragraph or 10 words that pop in your mind about mental wellness. And you're going to write down some things. And then I'm going to write down some things. And we're going to look at the list, and you're going to say, I didn't think about finances. I didn't think about spirituality. I didn't think about meaning and purpose. I was thinking about exercise and diet and meditation and yoga and psychedelics and all these things for the mind, but I wasn't thinking about the rest of the stuff. And I think that's the challenge as an advocate is, you look at the number one cause of divorce is money. Yet how much time do we spend talking to kids about money with their mental health planning? We don't. 0. And kids graduate college with lots of debt. inability to come up with large down payments for their first homes, menial paying jobs, quite often no job. And again, as an advocate, we want to talk to mental health. We want to talk mental health kids about mindfulness. And they're like, well, screw that. I can't meditate because I don't have a job. I can't, or I'm 50 pounds overweight. It's like, I think, I don't know. I get very frustrated in this siloed approach, this focus on one or two symptoms. And then we got this big game of whack-a-mole going on, I like to call. And I'm just trying to say, you know what? Like you say, you're a recovering clinician. Well, you're still a clinician. I never have been. You forget more than I'll ever know in my entire lifetime on these topics. What is the solution, especially for Gen Z, let's say, 12 to 26? What's the solution to get them in a better frame of mind with their mental wellness? And I don't know what the answer is.
I don't either, because I don't think there is any one answer, and I would never presume to think I could ever come up with it. I think the answer lies maybe more in process than in a product that here's what I could package as the answer.
Perfect. Yep. It's always a process. It's evolution.
And
right?
so that's how I would kind of frame that answer, is the solution. The process that I could see being the effective process is one that we're focusing a lot on. How do we collect more?
But the average consumer doesn't want process, though, Peter. They want a pill.
But
they want a TED Talk.
I mean, and going back to disrupting paradigm shifting.
Right.
What's a what's a symptom? What's a problem? Where's the tail? Where's the dog? And the wild circle that's being run. And with regards, when we look at how do we pose some of these solutions, we also have to look at what are the kind of existing paradigms that are going on out there? And in a very similar way to if I were to work with an individual and say okay, you're here and you want to be there. Now let's look at what's stopping you from getting there. One of the first steps is let's break down, in many regards, your operating system, your algorithm, and try and understand that, your values, your belief systems, which is going to kind of shape, how you see everything. That happens on, a very exponential scale. So you have that as individuals, that's in family units, that's how you have generational trauma, belief systems, and all of that, communities, cultures, and so it just keeps expanding. So you have these kind of, just as you might have as an individual, what we can label as toxic, maladaptive value and belief systems. You have that also as a society, where just what you said, I want a quick fix, I want a quick answer, that's what I need. But there isn't one. There is a, what's a quick fix or quick answer to lose 20 pounds or to gain a level of fitness to perform at X, way. So, part of it has to go and kind of re-engineer in how we're even asking these questions, how we're choosing to answer them based on what we're looking at.
Do you think it's possible that we're just overthinking this stuff? It's like Occam's razor, it's like, at the end of the day, and I can only go off me and my choosing not to drink. I just decided that it was easier not to drink. And I tricked my brain into not playing any narratives. I don't call myself sober. I don't count the days. I know what day I quit. I could drink today. I wouldn't punish myself. I would just say today I chose to drink. Tomorrow I'll have another choice. And I've just, to me, I can go to a liquor store, and I can go to the NA section and buy a case of NA beer and walk right by all the beer I liked. It doesn't pull at me. It's like, I can't be the only one. There can't be just, a handful of us out there like this. I was a raging alcoholic, dude. When Seth died, I drank for 14 months, 8 days a week, 9 days a week. I drank excessively, and I just literally quit cold turkey. And I'm like, okay, so when I talk to someone who say it's a disease and they're convinced it's a disease because their grandparents and great-grandparents and all that, and it's like, even if it is a disease, isn't there an opportunity for you to just not believe that? I don't know. It's like, God dang. It's like, I think sometimes we just over complicate this stuff.
I agree, and there's a lot
I
of research and data, that supports that in many ways. One, that the overwhelming majority, and the huge subset of data and research, going back to one seminal study studying returning vets from Vietnam, raging heroin addicts.
yeah.
They came
Yep.
back to the U.S. and why were the overwhelming majority of them able to, as we would define it, recover?
I've seen that study. It's amazing.
To a lot of
Yeah.
other variations of it, or other, similar lenses in which to try and evaluate things. And to your point, that was kind of the takeaway of it all, is the overwhelming majority of people self-correct. The overwhelming majority of
Yeah. And that was surprising when I heard that, Peter. I thought the overwhelming majority of people, struggle and battle it and all that, but a lot of people are like me. They just quit.
And so what we're really doing, and back to why am I a recovering clinician? Why am I frustrated and kind of needing to disrupt, is because
Right.
it should just be simple in many regards, not so different than what are incredibly complex other aspects of medical, mental health, behavioral health, issues that have exquisite solutions behind them. But this space doesn't. And largely because, and we've touched on it in other ways, there is so much internal stigmatization, hoarding, territoriality around, this way is the only way. Any deviation, variation means jails, institutions, and death, for good reason, But when you kind of, for that individual, like you pointed out, that phenomenon, well, this worked for me, so it's got to work for you. If you take that, and I don't want to knock 12 steps, but if you take, what would be, let's say, a cultural appropriation of 12-step philosophy, like, all right, one is too many, 1,000 never enough, off to the races, you're going to end up in jails, institutions, and death. You don't go to meetings, you're going to breathe ass, all that kind of stuff. It just doesn't exist,
Well, my turn off at AA, Peter, was my inability to succumb that there was something more powerful than me. And I'm like, you know what? I can look at a beer and it's not more powerful than me. I'm not going to give in. And that's just my competitive nature, I guess. And the higher power thing was a very big turnoff for me as well. And for my wife, she wouldn't go to AA solely because of the higher power emphasis. And she's agnostic as I am. And we didn't want to complicate this whole thing by bringing in some celestial entity. I know a lot of people have to do that. I'm all for the utility of it. But for us and for me, those two things were turnoffs. Having to succumb to this, like I'm bowing down, saying, you know what, I can't. I have to surrender my addiction to you. Someone take it away from me. I wasn't comfortable with that, Peter. And I think a lot of people aren't.
And for me, it's more than just comfort. It then gets into category where it can become even enraging in some regards, only because, and I don't want to bring up a sensitive topic, especially for you, but where the end result has been so often, and that is, unfortunately, fatal results or detrimental results. Because now imagine where it is, where it's posed as, here's the only solution. You've got to get on board, or this is what's going to happen. There might be, for whatever reason, just a complete incapacity for one to subscribe to that. So what's their takeaway? There's no hope. There's no success. There's no path whatsoever.
Yeah.
And, in well over a decade of practice, I can't count anymore. I ended up having to become almost detached emotionally from that phenomenon of just seeing people. And this is where, because that philosophy gets then embedded in the criminal justice system and reimbursement system, I would be liaising with drug court, PO asking, well, did they get a sponsor? Oh, they must not be serious. Like, well, I'm working with them clinically and they're dead serious. They're doing everything they can. So back to you.
Well, there's a whole nother subset of mental health concerns for the mental health advocates.
Right. And so back to
a lot of them are underpaid and overworked, and it's depressing every day because you're hearing everybody else's crap all day long and you got your own baggage. and you can't. It's hard to disassociate from that.
And in this space, and this is kind of what you said about, kind of not wanting to take on certain naysayers or whatever. Like here, somebody like me who's coming from the world of traditional recovery programs and practices, very deeply networked in that world. And now, fast forwarding to not only promoting, but putting into practice the use of psychedelics. Our docs were prescribing medical cannabis when appropriate for certain people. So a lot of people were telling me, "You're killing people. How could you do that?" And it was really disillusioning. But with all of the belief and vehemence, that, how could you do that? What are you doing? And
well, because you probably get people that reach out to you and say thank you, and you're like, that validates that you're doing the right thing, and then you get a handful of people that don't like it for whatever agenda they have, and then you get a note in the mail saying, "Hey, thank you."
I'll tell you
and
what,
it's like you go back and forth.
One example: Navy SEAL back. The statistics of suicidality with nothing was working, spiraling out of control, substances, behavior, suicidality. The only potential course of treatment up until that point, way long game down, looking at potentially ECT, probably a month or so before you can really actively engage that individual and have any hope to really sink in. Boom, an hour after a ketamine infusion, this individual is engaged, suicide.
Isn't that crazy?
Down to a negligible amount.
Yep.
And the ability to work with that individual over a course. And this was years ago, still in touch with that person who's flourished.
It unlocked something.
I'm sorry?
It unlocked something in that person.
Yeah, and that's where, back to what we were talking about earlier, really operated on multiple levels. Ketamine in particular worked on a physiological level where it opened up new pathways, synapses, and neuroplasticity that really healed aspects of the brain and areas that were shutting down and not working. There was, and particular to ketamine being, a dissociative anesthetic, it's working on a completely different mechanism within the brain. It's not working on the dopamine system. It's not working on the serotonin receptors like psilocybin is. You're disassociating. So at what would be a sub-anesthetic dose, you're getting almost what you were referring to earlier, that dissolution of ego. So you're able to look at and address things that you would never have been able to look at, not only emotionally, but in some regards, quasi-physically, because your brain as a trauma response conditioned over what might have been decades is not allowing you to access. So that, almost like this computer system, there's a bug there. And so you can really...
I just think that's so intriguing. I just think it's so intriguing. And I think we're at a point, a tipping point in our society that I just don't know if we can afford to wait to get more data or get more information on certain things. People are dying 800 a day in the United States from overdose, alcohol, and suicide.
And, by the way, I wouldn't be surprised if it was close to double, when you look at...
Well, yeah. And plus too, that's just the death statistics. Exactly. Think of the families that are destroyed and no death has happened yet. Those are in the millions. So it's like,
that just brings up another whole, like I said, apologies again, going on all kinds of tangents. Another huge, just systemic problem with this whole space that we're talking about is, who we're talking about and the what that's going on. And we're only treating the heart attacks after they happen. We're only talking about addressing these things after the crisis really hit. Back to models of other, or how is modern medicine set up? Early intervention, preventative medicine. Why aren't we doing more things early on? And so, that's just another big part of the process that would be leading to that solution.
Well, I know when I look at your information online, I see the Flow Initiative. So maybe as we wrap up the show, maybe talk a little bit about, maybe we already have talked about it, What is that? What is that exactly? And if people have questions, what's the easiest way for them to reach you,
The
Peter?
easiest way, I'll kind of go in reverse order. The easiest way is through the
Yeah.
website, www.flowinitiative.org. And what the Flow
Mm-hmm.
Initiative is an evolution of a lot of what we talked about. Um, I was
Mm-hmm.
very fortunate years ago to run that facility called the Recovery Spot. Doesn't really exist anymore. But we were really out of the box. It was with one physician I grew up with, I've known my whole life, addiction psychiatrist for 25 years, another physician, anesthesiologist, so it's one of the pioneers in utilizing ketamine for a lot of these purposes. Uh, and that really blew the box from what traditional treatment was all
Mm-hmm.
about. We were looking at a model of come in a half hour, 90 minutes, I'll diagnose you, assess everything there is to go. At its heart, it was all about integration and comprehension. How do we pull together the most
Right.
wide envelope of practitioners that we can to achieve the outcomes that we need? Because every individual is just that, an individual and different, and it's all in the
Yeah.
collaboration. So the Flow Initiative is almost an extension of that, in that it's a coterie of different practitioners, largely, I don't want to say only licensed clinicians, anything from physicians to
Mm-hmm.
licensed clinicians, but also, the experiential side of things. It's where Harry's, work, is impactful. How can you facilitate more connections? How can you instill more of a sense of purpose or just fulfillment?
Mm-hmm.
So an experiential angle of it as well. So you can check it out on the website. And I'm always available for.
And LinkedIn, you're on LinkedIn. That's where we initially met. And I'll have links to everything when this actually posts down the road here. Um, any last things you want to add as we wrap up the show? Again, I want to really thank you for the time you took to have this conversation. And I know you and I will be talking on many different levels in the future.
Um, I just to sum up in that sense, that we need to really upend the paradigms in how we just embrace in our relationship with recovery, substance use disorders. That's why I kind of hesitated, because it's not just substance use disorders, but substance use also. Uh, how we need to
Right.
blow up the box and what we view as appropriate, acceptable. The North Star is science, research, medicine. And we need to have more of these conversations. And I'm very grateful for you, the platform that you're now creating, the vision that you have with Living Undeterred, and how we can do more of that. Because back to solution and process, it's going to be more of this, more collaboration, more
Mm-hmm.
of these conversations. That's going to cause that disruption of what is just an unacceptable status quo right now.
Yeah, you can't avoid life. You just lean into it, and life is death. Life is chaos. Life is tragic. Life is unfair. It's unjust. It's unfortunate. But if we don't have a ability to reframe life as beautiful and precious and wonderful and a gift, then your whole life is going to be torture and pain and suffering. And it's like you don't have. It doesn't have to be that way. Again, we don't have to overthink life. We get up. We're alive. Great. Make the best day you can. Go to bed. Get up again. And I just think we are too captured with thought in the past, and we're too polarized by anxiety in the future, and we got to find this common ground. And so I think with that, I want to thank you again for being on the show. Really, I noticed my it's getting darker here. My sun is setting here in Iowa, so in the last half hour, I'm like almost disappearing off my camera. Um, but I want to really thank you for being on the show, and like I said, really look forward to tapping your wisdom and knowledge for some of the projects that we have at Living Undeterred going in the future.
I'd be honored to, because I'm really a fan of the work you're doing, and I'm very grateful for you, people like you who are doing what you do. So I'm really looking forward to staying in touch, staying in collaboration. And it's really exciting what we're facing, because to your point, there are things that can be simple and very effective, and the solutions that are out there are really, really amazing. So,
Yeah, I mean, like I said, doing this podcast, I meet people every day that have been through some amazing things, and they seem to be, progressing and taking advantage of the process of life and the evolution of self. And then I see others that just can't do that. And so that gives me validation that if I can glean information from those that can, pass it on to those that are struggling, then we can, provide a better environment, a better lived experience for more people. So keep living undeterred, my friend. Thanks a lot. We'll talk
Thank
soon.
you,
Okay.
Jeff. Stay well. Talk soon.